Hey everyone, my name is Nick Wignall. I'm a clinical psychologist and the founder of The Friendly Mind, a free weekly newsletter where I share practical, evidence-based advice for emotional health and well-being. And today we're going to be talking about panic attacks. Specifically, I'm going to go through 10 of the most common questions I get about panic attacks and try to answer them. We're going to look at things like what panic really is, where it comes from, and then a bunch of other questions about how can you stop panic attacks, whether taking medications like Xanax is good for panic attacks or not, things like the relationship between alcohol and marijuana and panic attacks, and then some other things around how we can help other people who are struggling with panic attacks. So this is going to be all things panic attacks. Panic is an area that I feel especially passionate about because it's been an expertise of mine for a long time. It was the primary focus and specialty of my clinical practice. So when I worked with folks one-on-one, I focused almost entirely on panic attacks. So it's something I have a lot of expertise in. I'm very familiar with the research on panic, and it's something I just care a lot about. But panic is actually a pretty misunderstood concept and experience, and a lot of the advice out there about what to do if you're having panic attacks, while very well intentioned, is actually often completely wrong and is part of the reason why people continue to struggle with panic attacks, because they're being given bad advice. Not maliciously, not intentionally, but because a lot of the people in mental health who try to help people with panic attacks don't have a deep understanding of what panic attacks actually are and what causes them. So I'm going to try and explain that and unpack that for you today by going through, like I said, this series of questions. So with that being said, let's dive in. All right, our first question comes from Kara H, who asks, what even is a panic attack? Now, Kara, I love this question because it is actually a really good question in the sense that while everybody kind of knows what a panic attack is, most people don't really understand what's going on with panic. So the technical definition of a panic attack is basically just an intense, acute form of anxiety. And it typically goes along with a lot of physical symptoms, things like heart palpitations, dizziness or lightheadedness in your head, knots in your stomach, could be tingling in your fingertips, increased respiratory rate or heart rate, things like that, right? And then also classically, there were two kind of essential symptoms that you needed to have at least one of, which was you were so anxious, the panic was so intense that you either thought you were truly afraid that you were going to die, or that you were going crazy, or you're going to lose touch with reality. Okay? So those are sort of the classic, that's kind of the classic definition of what a panic attack is. But if you'll notice, that definition is totally descriptive. It just describes what panic looks and feels like. What it doesn't talk about is what's actually going on underneath the surface to give rise to this. It's not a mechanistic explanation. And I think that's actually a much better way of thinking about what panic attacks are, is to think about what's going on mechanically underneath the hood to give rise to these very scary, intense feelings and emotions and sensations. So the way I like to think about panic attacks are, panic is essentially anxiety about anxiety. So what happens in any panic attack, no matter what the external circumstances or whatever the triggers are, it could be you're getting on a plane, maybe you have a lot of anxiety about flying, and that tends to trigger panic attacks. Maybe it's driving is another situation where people often get panic attacks. It could be social situations. Some people get intense anxiety and even panic attacks when they are, surrounded by a lot of new people or have to perform or speak in public, for instance. All of these can be triggers for panic, but underneath the surface, no matter what the trigger is, the mechanics of panic are always exactly the same, which are something makes you initially anxious. And again, that could be getting on a plane, it could be a comment someone makes about you, it could be anything. What happens in panic, though, is that initial anxiety, both the emotional part of it, feeling really afraid, but also the physical sensations that go along with anxiety, things like muscle tension or increased respiratory rate, all those things we went through before. People who have panic attacks immediately and often almost unconsciously start catastrophizing that feeling of anxiety. Oh my God, I'm getting too anxious. I'm going to have a panic attack. What if I lose control? What if I'm having a heart attack? So they immediately go from 0 to 60 on their anxiety. They get anxious about being anxious. And when you're anxious about being anxious, you just get way more anxious. Not only in the moment, right, but long term too, because when you start catastrophizing your anxiety, when you get anxious about being anxious, what you're teaching your brain is anxiety is dangerous. Anxiety is a threat. So even after that initial burst of anxiety or that initial panic attack subsides, you are actually now more likely in the future to get panic attacks because you've trained your brain, you've taught your brain to think that anxiety is a threat, is a danger. So understandably, the next time you encounter anxiety, your brain is going to make you more anxious. And that's just going to be more, it's going to be more likely that you get catapulted up into a panic attack again. Now, the question is, why would your brain make you anxious? Right? That doesn't make sense. Why would your brain want to do that to you? It sounds evil and cruel, right? Well, this gets to understanding, again, on a deeper level, what anxiety and panic especially actually is. So I talked about psychologically what it is. Panic is anxiety about anxiety. And when you compound anxiety together, when you get anxiety about anxiety, it catapults its intensity. It gets way more extreme to the point of panic. So that's sort of psychologically what's going on. That's what's going on on the sort of mental and emotional level. But physiologically, what's going on when you have a panic attack is it's adrenaline. And it's your body kicking you into a sympathetic nervous system response. Now, your sympathetic nervous system is what a lot of people call your fight or flight response. This is a system that we all evolved to have. It's a perfectly normal part of our biology, and its function is to keep us safe when we're in extreme danger, when our survival's at stake. So if you imagine you're out hiking in the woods and a bear walks out in front of you, right, and you need to get out of there quickly, your body, your brain is going to know, okay, this is a dangerous situation. We're going to activate the fight or flight system. I'm going to shoot them up with a little bit of adrenaline, because adrenaline is actually it feels uncomfortable when it's coursing through our veins, but adrenaline is basically a performance enhancer. It makes everything you do better. So your concentration, your attention, your muscle strength, your hand-eye coordination, even your memory is better when you've got some adrenaline surging through your veins. And that's what, again, kicks off the sympathetic nervous system. And the sympathetic nervous system response, this is really important. If you think about what happens, basically, your brain wants to keep you safe. There's a danger, a threat, and you need to either attack it and get rid of it or run away. In either case, what you need are more resources. You need more energy, essentially, to be able to work harder. So your brain, part of your sympathetic nervous system response is your respiratory rate increases. You start breathing faster to bring in more oxygen. Well, why do you need more oxygen? Well, when you bring in oxygen into your lungs, right, it gets transferred into your bloodstream, and then it gets sent out to your muscles. And oxygen is a core part of the fuel your muscles need to perform at a really high level. But in particular, your brain, your body is smart. It prioritizes that extra fuel into your limbs, especially your arms, because you might need to fight, or your legs, because you need to run away. So what's going to happen there is your breathing rate is going to increase to bring in more oxygen. Your heart rate is going to increase to more quickly distribute that oxygen, which remember is fuel, to your muscles, right? Especially to your extremities. Now, what happens as well during this process is the balance shifts a little bit in your body. Your brain prioritizes that fuel away from your head and your midsection and to your extremities. Now, this is important because when there's a slight shift, not all of it, of course, you still have blood and oxygen going to your brain and to your midsection, but it prioritizes those resources going to your extremities. So when you quickly have blood and oxygen leaving your head and your midsection, it can lead to some odd, strange sensations. This is why people feel lightheaded. They feel like they're going to faint. You can't actually faint during a panic attack. During a panic attack, it's the opposite. Fight or flight, your brain wants to keep you conscious so you can stay safe. Nobody actually faints during panic. Anyway, but that feeling of lightheadedness, that's the result of blood and oxygen quickly coming out of the head, right, and getting redistributed to your limbs. It's also why, for instance, you can get, during a panic attack, you can get that sensation of knots in your stomach or like tense abdominal discomfort. Again, that's because you're quickly sort of losing, not all of it, but some oxygen and blood, and it's being redirected to your arms, your extremities, your legs. And that's also why tingling and numbness can be a common sensation. You have a lot of nerve endings in your fingertips and in your toes, right, in your feet. And when you quickly have a lot of oxygen and blood rushing into those, it can set off those nerve endings. You can get that tingling sensation. So I say all this, I go into painful detail on all this because it explains all of those uncomfortable sensations we feel when we're having panic. Your heart racing, you're feeling tightness in your chest, right? Because you're breathing fast and your muscles are constricting. All these things, they feel like something's wrong, but actually they're a sign that your body is doing what it's supposed to be doing. You're supposed to be feeling like this when you are confronted with a danger. Now, the only problem is when you're having a panic attack, there's nothing actually dangerous. Planes are even more safe than driving in cars. We all know this intellectually. Other people, thinking you're dumb at a party or something like that, it's not going to hurt you. Your survival is not at stake if other people are judging you. What happens in panic, and really any kind of anxiety, is that your brain just gets confused. It thinks these things are dangerous when really they're not. And because it thinks they're dangerous, it does what it's supposed to do when it thinks you're in danger, which is activate your fight or flight system. Okay? So that's essentially what's going on with panic. Your brain is confused. There's something wrong with your body. When you're experiencing all those intense sensations during a panic attack, your body is not broken. There's nothing defective going on. Your body's doing what it's supposed to be doing. It's just activating this fight or flight response incorrectly in a situation where it doesn't actually need it. But it's critical to realize there's nothing bad happening. It's uncomfortable when you've got that adrenaline like surging through your veins and all those sensations that go along with a fight or flight response. It's really uncomfortable, but it's key to know nothing is wrong. Nothing's breaking. Your brain is just a bit confused. It doesn't actually need to put you into a fight or flight response. So I say all that because you have to understand when you're having a panic attack, that's what's going on. People who struggle with chronic panic attacks, the reason their panic attacks get worse and more frequent is because they end up trying to avoid their panic attacks, which makes all the sense in the world because they're so uncomfortable, right? Who doesn't want to stop feeling that way when they're experiencing panic? But what you have to think about is whatever happens during anxiety, especially really acute anxiety like a panic attack, what you do in response to that, you're sending a message, you're teaching a lesson to your brain. When you have extreme anxiety and you immediately try to either get rid of it or run away from it, avoid it, you're teaching your brain that anxiety is bad and a threat. And you're setting yourself up for way more anxiety long term because now anytime you get anxious, you're going to get even more anxious because your brain thinks it's dangerous. You're essentially teaching your brain to fear itself. That's what panic attacks are. You have taught unwittingly through your behavior by trying to avoid or get rid of or distract from your anxiety, you've ended up teaching your brain that it's dangerous. And now your brain is deathly afraid of anxiety itself. That's what catapults you into panic. So we've covered a lot of territory here in this first question, but to sum up, here are the kind of key points. Panic is anxiety about anxiety. It's what happens when you teach your brain that anxiety is a threat. Panic is caused by, ultimately, avoidance. The more you run away from or try to get rid of your anxiety and your panic, even if it kind of helps in the short term, it's going to make anxiety and panic more likely long term because you're reinforcing to your brain that anxiety and panic are bad, that they're threats and dangers. It's important to remember under the hood, anxiety and even panic, it's just adrenaline. It's your sympathetic nervous system kicking up. And while it's really uncomfortable, it's not dangerous or a sign that something's wrong or broken. Panic can't hurt you, right? As uncomfortable as it is, your body is doing what it's designed to do. It's very uncomfortable, but it's not dangerous. And then lastly, panic attacks are different than what's called panic disorder. I'm not going to get into panic disorder. Panic disorder is basically when you have chronic panic attacks and they're significantly impairing your quality of life. So you are starting to miss tons of days at work because you're terrified of driving and going to work, and so you're at risk of losing your job. Or your panic attacks are so severe that you've given up dating and you're socially isolating, you don't go out with friends anymore, things like that. Okay, so panic disorder is a clinical diagnosis. Panic attacks are, while terrifying, are actually a pretty normal experience. A lot of people, even if they don't have a psychiatric condition, experience a panic attack from time to time. But if you want to stop, if you do struggle with panic attacks, whether they're extremely chronic or just every once in a while, it's key to understand what they really are and how they work if you want to be able to overcome those and stop having so many panic attacks going forward. And that is actually the topic of our next question. Okay, Jamie C. asks the question, My therapist says that the best I can hope for when it comes to panic is to learn how to manage my panic better, but that I will always have panic attacks. Is it really not possible to cure panic attacks? All right, Jamie, good, tough question. And I think this is one of these answers reasonable people can disagree on this one, but I'm going to give you my slightly unusual take, or I think kind of countercultural take on this. Now, in general, the field of psychology and psychiatry, at least clinical psychology and psychiatry, they are understandably conservative about the use of the cure word. Because frankly, we just don't understand most psychiatric conditions all that well, whether it's depression or schizophrenia or bipolar disorder or eating disorders. We're actually just not that good at understanding really what's going on, why they happen, how they work, and what to do about them. Our best treatments for all of those things, for most psychiatric conditions, they're essentially band-aids. They're palliative in nature. They tamp down to varying degrees of success the symptoms, but they don't address the underlying cause. They don't correct the underlying problem. Okay? Now because this is true for almost all psychiatric conditions, we're hesitant to say that we can cure things. However, I think anxiety is different. I think we actually do understand how anxiety works on a deep level, both psychologically and even physiologically. I think it's pretty well understood. Now, it's not that well understood by most people, even most people within the realms of mental health, even professionals, because people don't have time to study every single thing. If you think about it like an orthopedist, right, it's probably going to not be that knowledgeable about the intricacies of different forms of cancer. They're a doctor too, but they just spend all their time on it in a different area. So it's actually kind of naive to think that any mental health professional is going to understand every single condition with a lot of depth and nuance. It just doesn't happen. My point is there aren't that many people who actually understand anxiety, but I think a lot of the people who have deep expertise in anxiety would tell you, again, we do understand it really well, and we are really good at treating it. At our best, we are really good at understanding how to help people overcome anxiety for good. And so I am going to make the claim, I actually think you can cure panic attacks. Okay. Now again, I'm not saying, dogmatically, this is the capital T truth. This is my opinion, and it's based on working for years. I worked primarily with folks who had anxiety and panic, and I had great success helping people overcome years, even decades of chronic panic attacks. And they, within the course of a few months to a year, people were completely free of panic. And as far as I know, did not continue to have panic attacks after that. So I actually do think it's possible to cure panic attacks. Now, I should qualify that with, I'm talking about panic attacks specifically here. Everybody has anxiety. Fear, anxiety, these are normal human emotions, okay? And it doesn't make any sense to think that you could get rid of, nor would you want to, really, get rid of fear and anxiety. Those are just inevitable. But panic attacks are an extreme form of anxiety that are brought about, as we discussed in the previous question, brought about by our own behavior, by how we respond to anxiety. We unintentionally end up making our anxiety worse by trying to avoid it and run away from it. And if you can learn to see that process and undo it and stop doing that and relate to and treat your panic and your anxiety differently, you can actually undo the process of panic. And I think avoid panic altogether. But even if occasionally, if you're having chronic regular panic attacks, you have to ask yourself, what does success look like? I mean, it would be great if you literally never had a panic attack again, right? But what if you could go from having, 10 to 15 panic attacks per year to 1 per year or 1 every couple years? That would be pretty amazing, right? So whether, we can debate whether you can completely cure panic or not. But I think what's pretty undebatable, if you talk to anyone who's really an expert in anxiety and panic, people can have incredible success overcoming panic to a very large extent if they know what they're doing and they approach it in the right way, which is a good transition because it actually leads to our next question. So Meg W asks, how do I stop panic attacks? I love the conciseness of that question, Meg. So to kind of frame up this question, I want to point out that this is really kind of two questions in one. The first question is, how do I stop a particular panic attack? In a given space and time, I start having a panic attack. How do I stop that? That's one part of the question, right? But the other part of the question in there is like, how do I stop having panic attacks generally? Now, luckily, I think the answer to the second question is really just getting good at the first one. So if you know how to address a panic attack in the moment, getting rid of or overcoming panic generally is just a matter of applying that process each time you start to feel really anxious and are on the verge of a panic attack. So this is probably the most counterintuitive, countercultural, strange thing I'm going to say in this whole video. To stop having panic attacks, you have to be willing to have panic attacks. That's probably, you're like, what? Right? That seems the opposite of what you should do. But here's the thing. Remember, when we're talking about what panic is and how it happens, ultimately, panic is always caused by avoidance of some sort or another. It starts off as you get anxiety, which is normal. There's all sorts of situations that are always going to make us a little bit anxious. You can't avoid that. But then how we respond to initial bursts of anxiety matter tremendously for how much more anxiety we have. And if you try to get rid of, like run away from or distract or eliminate, try to fix your anxiety, in either case, regardless of how you feel in the moment, whether it works or not, you're teaching your brain, hey, this anxiety thing, it's bad, it's a threat, it's danger. So the next time you experience anxiety, your brain is going to shoot you up with a little bit of adrenaline and make you more anxious. So now you're anxious about being anxious. And as we talked about, that compound anxiety just makes you dramatically more anxious than you would have been initially. So avoidance always leads to more anxiety in the long term. That is absolutely essential. You have to see that. Okay? It's really important to internalize and understand. But the implication of this is that if you want to reverse the process, you have to ask yourself, okay, well, if avoidance causes anxiety long-term and panic, what's the opposite of avoidance? If going that way makes my anxiety worse, what would it mean to go that way? Behaviorally, psychologically, the opposite of avoidance is willingness. Being willing to have anxiety. Feeling anxious and then saying, you know what? I don't like this. This is really uncomfortable, but it's okay. I know it's not dangerous. And go ahead, brain. You're gonna give me a little adrenaline, right? I can feel my fight or flight system revving up a little bit. I don't love it, but it's okay. I'm willing to have it. Ultimately, willingness is the way out of long-term anxiety and panic attacks because, again, you have to go back to this question. In my behavior, the way I act and the way I think, what am I teaching my brain? When you approach your anxiety and your panic, and when you're willing to have it, that teaches your brain, oh, this thing, it's not actually dangerous. If your brain sees you walking towards something, as opposed to running away from it or trying to attack it and get rid of it, it's going to assume it's safe. This is called safety learning. So by approaching and being willing to have your panic, you're teaching your brain, however uncomfortable that is in the moment, and it's very uncomfortable sometimes, you're teaching your brain, hey, this thing's safe. So that the next time you have anxiety, your brain's going to chill a little bit. It's not going to get so anxious. It's not going to shoot you up with adrenaline so much. It's not going to activate your sympathetic nervous system as much. Long term, that is how you eliminate panic, by teaching your brain that anxiety is safe. Okay? And the way you do that is you have to be willing to have your anxiety. Now, it's tough, and there's a whole kind of process and system for it. How do you get better at doing this, being willing to have anxiety? But there's a little kind of 3-step framework that I like that's a good place to start. I call it the AVA method. AVA is an acronym, AVA. And it's 3 really simple steps. The first A is acknowledge your anxiety. You say, hey, I'm feeling anxious. I'm feeling panic coming on. Okay? Instead of immediately going to, oh my God, what do I need to do? How do I get rid of this? Just label and acknowledge what you're feeling. V stands for validate. Validate means to remind yourself that no matter how bad anxiety feels, it isn't actually bad. It isn't actually dangerous. Right? It's understandable that I would be feeling this way because my brain's a little confused. Because I've been running away from anxiety for so long, I've been teaching my brain that anxiety is bad. Now I'm getting anxious about being anxious, which is leading to panic. Okay? So it's understandable that I would feel this way, even though I don't like it. It's okay. That's what validation is fundamentally about. Anything I'm experiencing internally, any kind of emotion, it's okay. Even those physical sensations, remember, that's just your fight or flight system. Nothing's broken or wrong. So validation is about reminding yourself, no matter how uncomfortable you are, no matter how scary it feels, nothing's wrong. You're not in danger. And then the last A is to act willingly. This is about act means instead of sitting and just focusing inwardly on your anxiety and how anxious you feel, or maybe what you need to do to stop feeling anxious, acting is about getting outside of your anxiety and getting on with your life, but being willing to have your anxiety while you do that. So if you're on a plane and you would plan to, watch a movie while you're on the plane, it might mean saying, you know what, I'm feeling anxious. I don't like that. Maybe even I'm having a panic attack. I'm feeling panic right now. It's okay. I hate it. It's really uncomfortable, but it's okay. It's not dangerous. So I'm going to be willing to have this panic, all these feelings and physical sensations and emotions, and I'm going to watch my movie like I plan to. That's the last and important step. That's when you do these three things, you are teaching your brain that anxiety and panic even are not dangerous. However uncomfortable, they're perfectly safe. And long term, that's the only way you're going to get through panic. Remember, the way to stop panic is to be 100% willing to have it. Okay, now at this point, whenever I explain this, I usually get a question, which is a really good question, that is, okay, well, how do I practice this? How do I do this if I only get panic attacks in very specific or unusual situations? Often this comes up with flying, people who get panic attacks while they're on planes or flying. So I don't want to say the great thing, but an interesting thing about panic is, and this is counterintuitive, things don't cause panic. Airplanes and flying don't cause panic. Driving doesn't cause panic. Anything in your life, a plane, a cocktail party, whatever, can trigger a little bit of anxiety. Panic is caused by getting afraid of and trying to avoid your anxiety. It's your reaction to being anxious that leads to panic. Now, this is really important and helpful actually, because what it means is no matter what the situation, the approach is always the same. You don't need an airplane to work on not having panic attacks, because what you need to do, you don't need to understand airplanes better. What you need to do is change your relationship to anxiety. So anything that triggers or stimulates anxiety can be used to practice dealing with your anxiety in a different, more productive way. That is, acknowledging it, validating, and being willing to have it. So if you tend to only get really anxious and have panic attacks on planes, you don't have to, buy plane tickets constantly to practice getting over your panic. You can artificially induce some anxiety in yourself and then practice dealing with that anxiety in a healthier way. I used to do this with clients that I worked with. We do things like I remember a client I had who got panicky on flights on airplanes, and the worst symptom was they get this like really lightheaded, dizzy sensation. And so what they needed to practice was being willing to feel kind of lightheaded and continue to do things anyway. So we designed this really funny, well, it didn't seem funny at first, but later on we laughed afterwards. But this situation where I'd have him sit in my office chair and he'd spin around in the chair looking up at the ceiling. And when you do that, you get really dizzy and kind of lightheaded. And that would trigger a lot of anxiety for him so that he could practice having anxiety and being willing to have it instead of avoiding it or running away from it. Okay, so the good news is you don't actually need the specific environment or situation. Anything that prompts or triggers anxiety can be used to practice creating a healthier relationship with your anxiety, which is ultimately the key to overcoming anxiety and panic attacks specifically. You have to change the way you respond and relate to that panic. Okay, so it's not about the airplane. It's about your own anxiety. Okay, next question. Sarah E. asks, I've been taking Xanax for panic attacks for the last 10 years. In general, I would say I have fewer panic attacks, but when I do have them, they're much worse. Is taking Xanax for panic attacks long-term a good idea? Okay, Sarah, I will qualify this by saying I'm not a medical doctor, and nobody over the internet should be giving you medical advice about what drugs to take or not. So I'm definitely not going to tell you, yes, keep taking Xanax or stop taking Xanax or anything like that. What I want to do though, is help you think about this dilemma maybe in a slightly different way And as a result of that, maybe you can go have a conversation with your doctor or whoever's prescribing the Xanax and reconsider if that's what you want to do. So there's a couple questions on this topic that I would consider you to think about. The first is, taking Xanax, is it actually working? Is it actually working? And there's kind of a couple ways to look at this. The first is, you said yourself, while the frequency of your panic attacks have decreased, the intensity seems to have gotten a lot worse. So I don't know, is it working? Maybe sort of in some way, but in some ways, not really, right? If anything, maybe it's making it kind of worse, at least in terms of the intensity dimension. The other thing to think about is, maybe you could make the case that it's helping in terms of it's reducing, symptoms, at least in terms of frequency, right? You're not having as many panic attacks, I guess. But is the underlying thing that's causing your panic, is the Xanax addressing that? I don't know. That seems like a harder thing to say yes to. And I would say, in general, my perception is we don't have any drugs for any psychiatric condition that actually fixes the underlying cause of a psychiatric condition. Anxiety, depression, schizophrenia, bipolar, any of that kind of stuff. All of our pharmaceutical interventions, which are tremendous, by the way, I'm not anti-pharmaceutical intervention at all. They can be very, very helpful, but they're fundamentally palliative in nature. They're about reducing symptoms. There's very little evidence that they actually correct whatever the underlying problem giving rise to those symptoms in the first place. Okay, so that's really important to think about. The second one is, like with any sort of medical or health intervention, you can't just consider the benefits. You also have to consider potential costs or downsides. So when people think about medications like Xanax, they think about side effects, right? Like, I take this medication and I get dry mouth, or it kills my sex drive. So all of those are important. But when it comes to Xanax in particular, but any kind of anxiolytic or anti-anxiety medication, a side effect most people don't consider enough, I think, is the psychological effect of using a drug like Xanax as an avoidance mechanism. And we've talked a lot about how avoidance actually makes anxiety worse in the long run. I've seen this over and over and over again with people who use pharmaceuticals or drugs like Xanax for anxiety. They feel really anxious, they get on a plane and they feel like they're starting to have a panic attack. And so they take a Xanax, right? And it seems to kind of, maybe it works, maybe it doesn't work that well, but it kind of takes the edge off, right? It alleviates some of those feelings, some of those symptoms. Maybe it kind of chills you out or calms you down a little bit. So in the short term, they feel like they work, right? Best case scenario. But again, you have to ask yourself, what am I teaching my brain when I get anxious and then immediately take a pill to calm down? What your brain sees is she's afraid of anxiety and panic, right? And so she's running away. And taking a pill is just a form to your brain. That's just one more. It just looks like avoidance. It's just avoidance. You're running away from this thing, which reinforces the idea that anxiety is dangerous, which means the next time you get on a plane, your brain is going to be even more anxious about getting anxious, and your likelihood of having a panic attack goes up. So this is really the catch-22 of taking medication for anxiety, is that even though they sometimes, not always, but sometimes help in the short term, they tend to be counterproductive in the long run because they reinforce avoidance and continue to teach your brain that anxiety is dangerous. And that, as we talked about, is really the root of all panic attacks, and especially chronic panic. Okay? So in general, I have never seen, and I've seen dozens, certainly more than dozens, 50, maybe 100 people I've worked with long-term and in-depth on panic. I have never seen someone use Xanax long-term and have a really positive effect on their anxiety. So take that for what it's worth. As you can see, I'm pretty skeptical of Xanax being a very good long-term intervention for anxiety and for panic in particular. But unfortunately, a lot of doctors and people who prescribe it, while very well-intentioned, don't have a deep understanding of what panic attacks actually are and what cause them. So I would really encourage you to have a really open, frank conversation with your doctor about this and some of the things you're concerned about. And if those conversations aren't productive, I would consider, looking for a new doctor who could be a little bit more thoughtful about your concerns that you have with Xanax as it relates to your panic attacks. All right, next question comes from Neville M., who asks, what are some good coping skills for managing panic attacks? All right, we're gonna do a little experiment here. What I want you to do is hit pause on this video, and I want you to ask yourself, given what you've heard me say so far about anxiety and panic attacks in particular, what do you imagine? How do you think I'm gonna answer this question? So go ahead, literally hit pause and give yourself 60 seconds and think through what do I think Nick's actually gonna say in response to this? All right, hopefully you gave that a little bit of thought. My answer to this question might be surprisingly blunt, which is there are no good coping skills for panic attacks. Now, I say that because by definition, a coping skill is just an avoidance mechanism. Coping, when you feel anxious and you're on the verge of panic, coping is immediately doing something to make yourself feel better. So it could be taking a Xanax, like from the last question. It could be trying to distract yourself by chatting with somebody. It could be doing a breathing exercise. It could be, smoking a joint. It could be also, basically anything can be used as a way to avoid or escape feeling anxious, feeling panicky. And the problem with that, it's not that there's nothing wrong with breathing exercises or with Xanax or, with any sort of tool we use. The question is, how are we using it? And critically, what is this teaching my brain? So the reason I say there are no good coping skills for panic attacks is because coping always makes anxiety worse in the long run by teaching your brain that anxiety is bad. When you immediately run away from or try and get rid of something, including anxiety, your brain learns to see it as a threat, as a danger, right? And whatever the result in the short term, long term, this tends to just lead to more anxiety and panic because you're reinforcing this negative, combative relationship with this important part of yourself, your own anxiety and even panic. So there are no good coping skills. The only way to overcome panic is to be willing to have it. We don't cope with it. We practice being willing to have it. It's very hard, but like so many things in life, what's easy in the short term often tends out to make life harder in the long run. And what's difficult in the short term often makes for an easier time in the long run. And that is absolutely true with anxiety. So the things that temporarily make us feel better, all sorts of coping, tend to be unhelpful and make things worse and harder long term. But being willing to have and tolerate that fear, that anxiety, that panic, as uncomfortable and difficult as in the short term, that is ultimately how we free ourselves from panic long term. All right, number 6, Timothy G asks, exercise seems to trigger my panic attacks. I love exercising, but I've stopped because I don't want to have more panic. Any advice? So this is a great question because this person is thinking in a very nuanced way about anxiety. They're thinking about avoidance specifically and how avoidance actually makes anxiety and panic worse. So props for that. Someone is on the right track when they're spending at least equal amounts of time, not just thinking about the anxiety and how the panic makes them feel, but they're thinking about their own avoidant behaviors and how those might be impacting their anxiety and their panic. Now, in general, exercise is super good for us across all sorts of dimensions. I'm preaching to the choir. I think everybody basically knows that. And it tends to be really helpful for anxiety as well. So I almost always, if they can, recommend that people continue to exercise no matter how much anxiety you have, including panic attacks. Now, the thing is, as this person, what's his name? Timothy, as Timothy said, exercise is especially scary if you struggle with panic attacks because the symptoms, quote unquote, the symptoms, how you feel physically when you're doing moderate or kind of intense versions of exercise, they're almost identical to how you feel when you're having a panic attack. If you think about it, your heart rate increases, your respiratory rate goes up, right? Your muscles tense, all these things, they're exactly the same across panic attacks and exercise. In fact, one of the things I used to do with my panic clients is I would tell them, when you're having a panic attack, take your pulse, right? Get out and measure your heartbeats per minute. Then the next time you're on a run or working out in kind of at least moderate intensity, again, take your pulse, see what it is. They're the same. So your pulse rate when you're having even the most extreme panic attack is about the same as when you're doing kind of moderate to intense exercise. The point being, it's not dangerous. It's okay for your heart rate to get elevated temporarily. Your body is perfectly capable of doing that. It's a normal adaptation to stress, which is sort of the commonality between both intense exercise and a panic attack. In both cases, what your brain's thinking is there's some sort of challenge or threat, so we're going to kind of rev up a little bit in order to meet that challenge effectively. So when you're exercising and you start getting panicky, it's not that exercise causes panic. It's that exercise triggers feelings that are the exact same as the feelings you feel when you're having a panic attack. What causes you to go into panic while exercising is that you are misinterpreting those sensations, those physical sensations, as a sign of panic instead of just a sign of exercise. This is what happens. When I exercise, my heart rate goes up, my respiratory rate increases, my muscles tense, all these sorts of things. So what I recommend in situations like this is you want to gradually reintroduce exercise in progressively more intense forms. So you might start with just walking, going for a brisk walk, and notice once your heart rate starts to elevate, you're going to start to feel a little bit anxious as that happens, as you start to feel those feelings that you associate with panic. Practice, remember AVA, AVA, acknowledge, validate, and continue to act willingly, right? Keep going, being willing to have the anxiety or the panic. And then once you get better at walking, move up to walking with some jogging and just progressively work your way up into more intense forms of exercise. But there's no reason you can't be exercising, even doing intense exercise, if you struggle with panic attacks. What's key to see is that the feelings they overlap because they're the same, but exercise itself doesn't cause panic. It leads to symptoms that are the same as panic, and it's our interpretation of those physical changes that leads to panic or not. All right, question number 7. Eileen O asks, what's the difference between a panic attack and an anxiety attack? Okay, so there's no technical definition that distinguishes panic attacks from anxiety attacks. This is just a language and how people use the terms. In general, people typically call an anxiety attack is like a milder, less intense version of a panic attack. It's more intense than kind of normal everyday anxiety, and it comes on kind of suddenly and it's kind of acute, but it's not as overwhelmingly intense as a full-blown panic attack. And often, a panic attack typically has either fear of death or going crazy and losing touch with reality. So I think generally an anxiety attack is just a less severe or less intense version of a panic attack. Now, this question, though, I'm going to use it as a platform to talk about a related issue, which is if you struggle with panic, I would really encourage you to be mindful of the language you use to discuss your panic and your anxiety. Personally, I really dislike the term panic attack or anxiety attack because if you think about it, built into those terms, the words attack, they already put you into this combative mindset when it comes to anxiety. They encourage you to think of your anxiety as an enemy, this like invading force that somehow, gets into you and starts causing all these troubles. But in reality, as we talked about, when you treat your anxiety like an enemy, it tends to just become worse and worse and worse over time. Trying to get rid of it or running away from it, as we talked about, only makes that anxiety and panic worse long term. Instead, you want to treat your anxiety and your panic like a friend, like someone who is concerned about you and cares about you and thinks something's wrong, even if they're mistaken. They think something's wrong and they're trying to help you. Your brain, even in the worst panic attack imaginable, your brain has your best intentions at heart. It's trying to help you. It thinks there's something wrong, right? And it's doing what it thinks it should do to help you deal with that threat or that danger. So even though it's misguided and it's confused, it's not trying to hurt you. So be careful about language that immediately evokes combat or this kind of like having your anxiety being an enemy or something you need to destroy or get rid of or overcome, even overcome. I say that sometimes. Really, it's not about overcoming panic and anxiety. It's about changing our relationship with them. When we start to approach and be willing to tolerate anxiety and panic, that's how we teach our brain that they're safe and they're okay. And ultimately, long term, that's what leads to having less and less anxiety and panic long term. So I would just encourage you, be careful, be thoughtful about the language you use to describe your anxiety and your panic. All right, question number 8. Jeff T asks, my doctor said alcohol and marijuana make panic attacks worse. Is that true? Okay, so it's a little bit complicated. There's a lot to this, but in general, I'd say yes. That is absolutely my experience. I'm not going to get into the kind of medical or physiological reasons why that might be the case, although there are a lot of kind of causal pathways there. But instead, there's a very simple psychological explanation for this, which is something we already talked about when I answered the question about Xanax, which is anytime you're responding to anxiety with avoidance, you're going to make it worse long term because you're teaching your brain that anxiety is bad, that it's a threat, and that's just going to make you anxious about being anxious long term. And this is typically what people do with alcohol and marijuana when they have anxiety, is that they use drinking or smoking as a way to calm down, to eliminate or to decrease their anxiety. And while it temporarily takes the edge off or alleviates some of that anxiety, it tends to make it worse in the long run. So I think what your doctor's saying is definitely true. And I would really, anyone who uses alcohol and marijuana as an avoidance mechanism, as a way to feel less anxious, I would really encourage you to consider, whether that is truly helpful long-term or not, or whether it's just a very short-term solution and kind of defense mechanism that is, unintentionally making the anxiety worse over the long term. And the way to think about this is just to ask yourself, all right, how long have I been doing this? How long have I been using marijuana or alcohol to deal with my anxiety? And over that stretch of time, is it actually helping? Overall, am I getting less anxious? Am I having fewer and less intense panic attacks? And if you can't say confidently yes, then that would suggest that those things, using alcohol or marijuana, aren't actually helping. At best, they're like Tylenol. They're sort of blunting the pain. But are they really addressing the underlying problem? And almost always, I would say, no, they're not. And in fact, they're probably making it worse. Okay, Andrew C. asks, I get panic attacks while I'm driving. Should I pull over when that happens, or would that be bad because I'm avoiding/coping with the panic, which will only make it worse in the long run? Again, great question, because this person's thinking not just about the anxiety, but about avoidance and how avoidance and their behavior might be impacting that anxiety, including long term, not just in the short term. So the basic answer to the question is, if you truly think that you're in danger or that you're putting other people in danger when you're driving, then yes, of course, pull your car over. That's the most important thing, okay? That said, having worked with a lot of people who had panic attacks, especially while driving, most people aren't actually in danger. The danger people always worry about is like, I'm going to pass out. I'm going to get so anxious. I'm going to have such an intense panic attack that I pass out. And then that would obviously be dangerous. As we talked about, that doesn't happen. You don't pass out when you're anxious or when you're having a panic attack. It can feel like it because you can get lightheaded or you can get the kind of brain foggy feeling. But as we talked about, that's not because you're going to pass out. That's has to do with kind of a change in the sort of the levels of blood and oxygen in your brain, reprioritizing that to your extremities rather than your head. And it leads to those sensations, but it doesn't actually lead to passing out. If anything, during anxiety and during a panic attack, your blood pressure is elevated. You pass out when your blood pressure gets too low. So it's sort of like the opposite. Anyway, I think if you're really struggling with this dilemma, what you want to do is progressively kind of show yourself that you can be anxious and continue to drive in a safe way. So if you really get anxious when you're driving on freeways, practice on smaller side streets. Or even if you get super anxious, even driving on smaller side streets, go to an empty parking lot some evening or early in the morning or something like that, and just practice in a very safe, kind of controlled environment. And again, what you want to practice is you want to show yourself, I can feel anxious and I can continue to kind of live my life, to drive, for instance, and be fine, right? It's not actually dangerous. And the more you do that, the more confidence you will have driving, even when you get a little bit anxious. But even more importantly, you will end up feeling less anxious and having fewer panic attacks long term because you've taught your brain, you're teaching your brain that anxiety, however uncomfortable, isn't actually a threat. All right, final question. Mac V asks, how can I help other people who get panic attacks? My wife and son both get panic attacks, and I don't really know how to help them. Any advice? Yeah, Mac, this is a great question. I actually have another video on how to help people who are anxious, which you might want to check out. You can just search for that or look in my previous videos. But in general, what I would say is a few things. The first is ask them. Now, maybe you have already, but a surprising number of people in this situation have never actually asked the anxious people in their life, hey, when you get really anxious, like what would be helpful for me to do in those situations? It maybe because it feels a little awkward or a little strange, but that's the first thing you should definitely do. Now, So sometimes you do that and maybe you'll get some really good answers. People have very specific ways that they want to be supported when they're anxious. Great. Sometimes though, people will just say, well, I don't know. They're not going to have any good information. So it's not going to be super helpful. My next thing that I would say after that is be careful of not making the problem worse. Now, there's a lot of ways to potentially make someone's anxiety worse, but a subtle one that a lot of people fall into because it seems like the right thing to do is don't allow yourself to become an avoidance mechanism. Specifically, be careful of other people in your life who are anxious using you for reassurance. Now, reassurance, I'm not going to get into the whole dynamic of how reassurance and anxiety works, but a lot of people, when they feel anxious and don't know how to deal with their anxiety well, they immediately go to other people to tell them, oh, it'll be okay. So they're using other people to avoid or eliminate their anxiety. And like any kind of coping mechanism, this just tends to make it worse in the long term, even if temporarily they get some relief. So you really want to avoid, like if someone says, oh, I'm so anxious, like what should I do? What's going on? You want to avoid things like, oh, you'll be fine. Like it's nothing. Don't worry about it. Everything's going to be okay. Those sorts of things. Especially if you can tell that they're sort of, again, I don't mean this, like, not that they're being manipulative, but it's very normal when we're feeling anxious to seek comfort and have someone else try to get rid of it for us. But again, tends to be unhelpful long term. So if you notice that dynamic, what you want to try and do, remember the AVA method, AVA, you want to acknowledge your anxiety. Gosh, it seems like you're really anxious right now. Validate it. I get it. It makes sense that you would get super anxious after, being criticized so much in that meeting at work or something like that, or getting on an airplane. I know how stressful and anxiety producing that can be for you. It makes a lot of sense. It seems really tough that you're feeling that anxious. So that's the validate stage. Acknowledge, validate, and then you want to help them act being willing to have the anxiety. So saying, you know what, like, I know you're feeling really anxious, but I think you can do it. I think you can get on the airplane despite feeling anxious. Or I know this is really tough and you don't want to go to the party because you're afraid of getting anxious, and you certainly don't have to, but I think it would be a good idea for us to do it anyway. And if it gets too much, we can talk about it or we can leave, but I'm going to be there with you and let's do it anyway. Okay, so I think you want to be careful of becoming an avoidance mechanism for someone, especially via reassurance seeking. Again, you can work through that AVA method for someone else. So acknowledge, validate, and then act while being willing to have the anxiety and tolerate it instead. All right, that's it. I hope this has been helpful and instructive. If you want to learn more from me about anxiety, worry, panic attacks, stress, and other aspects of emotional health, I write a free weekly newsletter called The Friendly Mind, and you can sign up for it for free using the link in the description below. And then also, I have a course called Creating Calm that is all about overcoming chronic worry and anxiety. It's kind of my playbook and step-by-step method for how to do that. So if you're looking for something more structured and in-depth about dealing with anxiety, again, you can check that out. There's a link for it in the description as well.